Hello students, this is Dr. Ways and welcome to your lecture on the female reproductive system. So we'll start with an overview of the external and internal anatomy of the female reproductive system. And we'll begin with the picture on the right here showing the external genitalia of the female. In a female that's standing up in anatomical position, this would be the anterior portion of the external genitalia, but as it's being viewed right now, it would be the superior view of the external female genitalia. And so at the most superior border, we'll go from superior to inferior, we have the glans clitoris, which is the analogous structure to the penis in the female. And below that, we have the labium minora or labium minus. Outside of that, or peripheral to that, we would have the labia majora. Just inferior to the clitoris, we have the urethral opening right here. And we talked about the urethral opening in females as being, that's its general location, but in different females, it can be in different locations. And, that's not important for normal everyday functioning, but when you are trying to identify genital urinary tract dysfunctions or trying to catheterize a female patient, it then becomes an issue. All right, so excuse me, this general opening here, this general space is referred to as the vestibule, and by definition it is between the labia minora. All right, and it's partially covered by a hymen, although not all females have a hymen. Especially if they're sexually active. And then there's the vaginal opening, which is also known as the introitus. All right, below that, marking the inferior border or the posterior border, would be the fourchette. Now notice what we didn't say in here is the vagina, because the vagina is not in this picture at all. What the vagina is the tube that extends from the introitus all the way to the cervix of the uterus. All right, so specifically that is the vagina, but in general vernacular we tend to refer to all external genitalia as the vagina, where it specifically is the canal here. So moving up the vaginal canal, we have the cervix, cervix means neck. Literally, this is the neck of the uterus. So that would make the rest of this the body of the uterus. Lateral to the uterus, we have the uterine tube, which then extends out into what we call the infundibulum. And loosely attached to that is the ovary. All right, and we'll go into more specific anatomy later on. And when we get to the lab and do anatomized dissections on this, we'll see how all this is put together, especially the ligaments that are involved as well. All right, notice that the vagina and the uterus are between the urinary bladder and the rectum. All right, so the uterus tends to sit posterior and superior to the urinary bladder. And here's the urinary bladder, here's the urethra going through the perineal membrane into the opening between the labia minora. All right, and then just posterior to the uterus would be the rectum, and then here would be the anus. All right, also to notice on this picture, although it's not labeled, is the clitoris or the erectile tissue of the female reproductive system. All right, going into a little more detail, we have the round ligament of the uterus right here. And remember we saw previously when we were talking about the inguinal canal that this structure is analogous to the spermatic cord in males, and it's anchored into the skin and connective tissue of the abdominal wall, and then it traverses through the superficial inguinal ring, through the inguinal canal, and then through the deep inguinal ring, heads into the pelvic cavity or abdominal pelvic cavity, and then attaches to the side of the body of the uterus. And you have one of these for each side going in. And again, those are analogous to the vas deferens in the male. All right. Again, here's the urinary bladder, just to point that out, and the urethra going here. Notice it's going through the perineal membrane, and then just posterior to that you have the vaginal canal also going through the perineal membrane, just posterior to the urethra. All right. If we follow that vaginal canal up, of course, we have the cervix right here and the os, or the opening of the cervix. And then this would be the lumen of the cervix. This would be the bulk of it. And we're not going to go over this, but there are different layers to the cervix: the perimetrium, myometrium, and endometrium. And although it's not shown extending from the lumen of the uterus, we have the uterine tube here. So this is going to be a hollow tube that comes up, and this is going to be suspended behind fascia within the pelvic cavity. And then it opens up into this enlarged structure called the infundibulum. And then we have the and we have that covering the ovary, and of course the ovary is where female gametes are produced. All right, and that ovary is held into place by the ovarian ligament, or ligament of ovary, which is also attached to the lateral aspect of the body of the uterus. Now in the picture in the bottom here, we see these two erectile tissues. Those would be the crus of the clitoris, and notice they come together. That's very similar to what you'd see with the crus of the penis, again analogous to the corpora cavernosa. And then we have these bulbs of the vestibule, which are analogous to the bulbs of the penis that would come together to form the corpus spongiosum, but instead, and then ending at the glans penis. But instead of coming together to form the corpus spongiosum, they come together to form the glans clitoris, which is the analogous structure to the glans penis in the male. All of these structures are erectile structures in the female, and when the female is sexually aroused, these structures will also engorge in blood, causing swelling of the external genitalia in the female. So you would see an enlargement of the clitoris, and these bulbs of vestibule lie just underneath the labia minora and cause them to become engorged and have a thicker appearance. On the posterior border of the bulb of the vestibule, you have the greater vestibular gland, also known as the Bartholin Gland, is a more common name to it. And if you look carefully at the vaginal canal here, you can see this little, see this little hole right here. That is the opening for these Bartholin glands, and these Bartholin glands will secrete fluids that will help lubricate the vaginal opening to prepare for intercourse. In addition to the Bartholin glands, you have these structures called Skene Glands, and so I'm going to direct you to this picture over here. The Skene Glands are in green, and you notice that they're going to be on either side of the urethral opening, kind of between the urethral opening and the opening or the introitus of the vagina. And these have a very similar function. They will secrete fluids that will help lubricate the vaginal opening to prepare for intercourse. Similarly to what we saw in the male, this is an inferior view of the pelvis in the female, and here we see the crus of the clitoris attached to the medial border of the pelvis along the pubic bone, and coming to and meeting together where just inferior to the pubic symphysis right here. All right, and then of course it ends in the glans clitoris, and the glans clitoris is then an extension of the bulbs, these vestibular bulbs right here. All right, and then here is your urethral opening, here is your introitus, and here are the vestibular glands, and notice that they have little ducts that go into the vaginal, directly into the vaginal canal, all right, secreting fluids. All right, if we look up here, we see a cross-section of the body of the clitoris. So let me erase and pick green. The body of the clitoris right here. So this is a cross-section of that. And you notice that it has a very similar structure to the corpora cavernosa of the penis, and of course very similar function. Its job is to engorge with blood and become erect, and that will help with sexual stimulation during intercourse, as well as making the vaginal opening more receptive to a penis for intercourse. All right, moving up to the cervix and the uterus. All right, so here's the vaginal canal again. And we talked about this is the cervix. All right, so the cervix is the neck of the uterus, and the opening to the cervix is called the external os, or just the os, if you will. You have an external os and an internal os, so an opening from the external portion and an opening from the internal portion, depending upon the perspective you're talking about. On either side of the cervix, you have these potential spaces that are between the vaginal canal and the cervix, and those are called fornices. That's plural, fornix for singular. One anterior and one posterior. Of course, remember the urinary bladder would sit right here, so the uterus, the body of the uterus is facing forward, and so that's why this is the anterior fornix and this is the posterior fornix. You would have the rectum and anus right here. All right, just another way of looking at it. Vaginal canal, cervix, internal os, or external os, sorry, internal os, and these would be part of the fornices, and here they would be called lateral fornices. You have to remember that and we'll see a picture of this in a few slides, that the cervix is round and the vaginal canal surrounding it is also round. So, you know, if you're talking about the space between the cervix and the wall of the vaginal canal, on either side of it, it would be lateral. And if you're talking about it on the anterior posterior borders, it would be anterior or posterior. The rest of this is the body of the uterus. All right, so the most of this is the body of the uterus. And then this hump at the top is called the fundus. Just like you had a fundus of your stomach, the bump at the top of the uterus is also called the fundus. And that's going to be really important if you go into OBGYN and you're trying to determine how large the baby is, or if the uterus is shrinking after the woman has had the baby. You're going to want to feel for the fundus, and so it's good to know what it is and where it's located. All right. Earlier we talked about the lumen of the uterus, and that it is continuous with the lumen of the uterine tubes. All right, these are also known as fallopian tubes. All right, I prefer uterine. And they extend upward until they get larger. All right, and that enlargement is called the infundibulum. And of course, the infundibulum would be where the would surround the ovary, and where the ovary would sit. So here's another view of the cervix. All right, so this is the actual cervix itself, the big, the neck of the uterus, and this would be the external os right here. This would be the wall of the vaginal canal. And so the space between the two, as we talked about on the previous slide, would be referred to as a fornix. And since it's on the side, that would be each one the lateral fornix. This would be the anterior fornix, posterior fornix. All right, and you know when you're looking at your patient that they're in a recumbent position. And so this would be the superior border. This would be the inferior border. And remember, that's also known as anterior and posterior. So that would obviously be the anterior fornix and posterior fornix. And then here is just showing you a similar picture. Here's your blade of the speculum, blade of the speculum, blade of the speculum, opening up that vaginal canal so that you can see clearly the cervix as well as the os to the cervix to determine its health. All right, there are several ligaments to the uterus as well as to the ovaries, and you will need to identify them, and we'll go over them here in lecture, but you will definitely see them when you do your dissections in the anatomage table. All right, we've already talked about the round ligament right here of the uterus, and remember that goes through the inguinal canal and then plants itself into the actually what would be the labia majora, which is a structure that's analogous to the scrotum in the males. Just superior to that, but still lateral to the uterus, on the uterus rather, is the ligament of the ovary, and that is literally what's going to be holding the ovary in place to the uterus. But then you have a suspensory ligament of the ovary on the opposite side, on the lateral side of the ovary, excuse me, outside of the infundibulum of the uterine tube, that will contain arteries and veins to give that ovary a blood supply and be able to drain fluids from the ovary as well. And then encased, all these ligaments are holding the uterus and the ovary in place, but the uterus as well as the uterine tubes are encased in this broad ligament, so it's more like a sheet that is covering up all of these structures and kind of holding everything in place. All right, I just realized that I forgot to mention when we talked about the infundibulum, the little appendages that are coming off are called fimbriae. Little fingers is what that means. All right, and so this picture is just showing you another view of the round ligament, uterine tube, and where they are in relation to each other, and that on the left side and the right side. And how the suspensory ligament carries in the ovarian artery. Notice that the ovarian artery also goes to the uterine tube, and then down here to the ovary as well. All right, blood supply to the female reproductive organs internally. Again, we have this internal pudendal artery, so that's going to be a really important source of blood supply. And of course, that comes again from the internal iliac artery. And that pudendal artery is pretty much the main artery of the perineum, and is generally going to supply blood to the erectile tissues of the clitoris. All right, so we also want to notice that the internal iliac artery here splits into the posterior and anterior trunk of the internal iliac artery. And coming off of that anterior trunk, we have the uterine artery right here, and obviously that's going to go to the uterus. We have umbilical arteries right here that are going to give rise to your superior vesicular artery, and of course the superior vesicular artery would give supply the bladder, the urinary bladder, with blood. And then you have the vaginal artery coming off of that uterine artery, and of course that would supply the vaginal canal with blood. All right, just another view of the vaginal artery and the uterine artery, making note that they are branches of the anterior trunk of the internal iliac artery. And then we have ovarian arteries, and if you remember, the ovarian arteries come from the abdominal aorta. And we said that the abdominal aorta had two branches called gonadal arteries, and so since we were talking about the female here, those gonadal arteries would be ovarian arteries, and they're going to travel down and obviously go to the ovaries, and when they enter the pelvic cavity, they're going to enter and travel along with that ovarian ligament until they get to the actual ovary itself. All right, for the nerve supply, a big one here, you're going to have the pudendal nerve, which is going to innervate the skin and skeletal muscles of the perineum. And that's going to include the external anal and external urethral sphincters as well, like those voluntary sphincters that we have control of. All right, so we didn't really discuss that much in the male, but it would be very similar and have similar functions to what we're seeing here in the female. All right, so if we trace that up here and look at the pudendal nerve, we notice that it's coming from S2, S3, and S4, which are your pelvic splanchnic nerves. So, you know, the parasympathetics going to that area. And as for venous drainage and lymphatics, again, just like in the male, venous drainage is going to follow similar pathways that the arteries did. And if you look, especially right here, lymphatics are going to follow similar pathways as well. Again, eventually emptying it into this thoracic duct and then up into the, dumping into the venous circulation.